kinds of minimal access surgery to ensure that the average length of stay is lower and the outcomes are good, to all the radiation therapy, fancy and sophisticated machines we have, to the only proton therapy center covering a population of 3 million for Africa, Asia, Oceania, at the Apollo Proton Cancer Center in Chennai. The concern is we have to focus on prevention. Because when they come, patients come to us at stage 3, stage 4, no matter how sophisticated the treatment, the outcomes are not where they would be had that cancer been picked up in stage 1. COVID, of course, has totally changed the way we've lived life. And if you look at COVID-19 and Apollo's response, we have got Project Quach, which is a 360-degree response from prevention, early diagnosis, quarantine, management in hospitals, management at home, in hotels, through I-stay, rehabilitation after you go home. Considerable amount of experience that we have garnered over the last 14 months. We've treated 125,000 patients with COVID. We've done more than 700,000 tests. We have 2,300 dedicated hospital beds. In addition to STAY-I, 100 fever clinics, an AI-based self-risk assessment tool on Apollo 24/7. We've changed our protocol 35 times to make them contemporary. And of course, we published the second highest number of papers on COVID, 195 papers that are listed on PubMed Central that have COVID consultants. But what I want to take 30 seconds with you and is share our work with machine learning and some data analytics. So we looked at, could we predict the risk of dying at 7 days and 28 days by looking at 23 parameters, clinical and lab. And what we found is, what we did using sophisticated analytics is to calculate the hazard ratio, and it went from 1.2 to 3.9. So let me explain that. If an individual had diabetes, there's a 1.2 times risk of dying compared to someone who doesn't. 1.04 times with hypertension, 1.56 with heart disease, 3 times with chronic kidney disease, and nearly 4 times with chronic liver disease. And we found that those with heart disease are likely to deteriorate faster, and they might die at 7 days compared to the others, where it might be 28 days. So this is a very powerful tool that is just going to be published. And of course, our work on our approach was published in NEJM Catalyst. So using the AI work that we've done, so as you see this chart warm up, if we look at diabetes hotspots, so 16 million people took the Apollo 24/7 COVID scan, and this heat map represents 1 million responses. And you can see clearly that in Delhi NCR, Punjab, Haryana, Kolkata, Mumbai, Ahmedabad belts, in Hyderabad, in Chennai, and in Kerala, and certain rural pockets in Madhya Pradesh, UP, Bihar, Odisha, and Gujarat, we have a serious issue with diabetes. Now, if we look at hypertension, and again we look at this heat map that represents 1 million responses, we can see here a prevalence of 8.18%, and this is in Delhi NCR, again Punjab, Haryana, Kolkata, Mumbai, Ahmedabad belt. We see Kerala, how it lights up, parts of Tamil Nadu, Chennai, Hyderabad, and then some rural areas in Madhya Pradesh, in UP, Bihar, Odisha, and Gujarat. So we have, friends, to summarize, a serious problem with NCDs, and we need to act now. And I think with the kind of technology that we have access to using AI, ML, we can really make some very powerful predictions, and more importantly, be able to have measures in place to prevent progression and to optimize management. I'm now going to invite Professor N.K. Ganguly, former Director General, Indian Council of Medical Research and President of the Apollo Hospitals Education Research Foundation, to tell us about the Total Health project that we have in Andhra Pradesh. Over to you, Professor Ganguly.
Thank you, Dr. Selval, and thank you, Chairman Sir and Mr. Reddy for this opportunity. I will tell you the story of Aragonda, our Chairman Sir's birthplace, where a silent revolution took place on a health system reform which has never seen anywhere in the world. This is the community which had 27% anemia, which has got 7% people consuming alcohol, about 13% women chewing tobacco, as well as there was an open distribution of 52% of people. There was an obesity in women of about 11%, more than 29 BMI, as well as there was poor water supply and garbage collection. So this was the situation in this community. This community now, with the catalyst action of the Apollo group, participated in this revolution. So this was a health system reform where there was an active participation of the community. And this became one of the only rural the demographic disease surveillance system in India. There is none other, and very few in the world. There are four such system in the total world, where every household health record data is available. This was collected through four very innovative systems, which is again something first. It was through household survey, through mobile clinic, which could do the diagnostics to the biochemistry, and innovation was even could be done at the doorstep. The third was the satellite clinic, which were four clinics in which people participated after they were diagnosed with high risk, and they could go and seek treatment and diagnostic. This was even before the Mohalla clinics came up and the Prime Minister's program came up. This was conceived, and this was a major innovation in India. And Ayush integration also occurred in this particular area. So if I want to compare it, the panel in the histogram shows you the Andhra Pradesh, because Nalgonda is in Andhra Pradesh profile. If you see people below 40 years, there is almost same NCD and communicable diseases. It grows steeply as you reach 40 and above and 70 and above. The injuries were the major cause of death in people below 40, and it reduced. If we look at the participation of the various NCDs here, the major was the cardiovascular, that is 20%. 11% was cancer, 7% was diabetes, and the COPD was around 9%. So this is the Andhra profile. If I go to the Anaconda now, in the Anaconda, if we really look at this, there will be about 6.2% we found to be diabetics, in which 3.5% were newly diagnosed, and there was 10% hypertensive, where 12.5% were newly diagnosed. They never knew that they had this particular disease. There was a women's health survey of the cancer, cervical and breast cancer. Here a major innovation occurred with the Philips company. There was a colposcope which could be inserted by the nurse for even class 8 or 10 trained girls. And this throughout images which went to the caregiver, and they provided the major inputs of how to do this. And trials are ready to be performed on the site, and some were referred in this health system. The Chittoor Medical College was one of the tertiary reference center. I would like to say something, that this was one of the major public-private partnerships with Andhra Pradesh government. And yesterday, Mr. Alok Kumar of the UP government said, praised this. He had a discussion with Dr. Sanjita Reddy, and he praised it in a group in which I participated, that they will follow this particular model in UP. So the cancer patient which needed to be treated, they were sent to Chittoor, and if necessary, were sent to Chennai. And this was totally free of cost. So this was the profile, and in this profile, about 1,980 diabetics and 35,350 people were divided into low risk, medium risk, and high risk. And they were followed up in this clinic and the Vicky hospital in Anaconda. Now here, the major innovations were this, that they didn't have to spend, they had to spend only very marginal amount of money. At that time it was 30,000 rupees insurance, and this was covered through that. But none of the technology work if there is no social development index which happens. So one very important innovation is happening over here, that the system put money in the pocket of the women. They were trained by U-Boat for handicraft, they were trained for hospital apparel, the COVID mask and other. They were trained for sanitary napkins as well as the paper bags. And these were socially marketed, and the money they got from the bank account, and they got money in their pocket. And this became the driver of the growth and economy of this particular place. The children were educated in a school, very modern school, which has a system with Cyprus. And these, their adolescent children or grown-up children, they are trained by the Blue Star for refrigeration and other, and they got jobs. And the Tata Steel Development also trained them so that they got jobs. This was a mango-growing country, and the mangoes were actually wasted. So here, there was a partnership with the food processing, so the packing and food processing of mango occurred, and there was money in the pocket of the community. There was the sanitary, the water was provided with another innovation, which provided at least 25 to 26 liters of water to every household over there. The similarly, the sanitation was provided, which was an unmet need, and housing. The India Awas Yojana housing was introduced into this area. So total revolution occurred into this. But one major thing I will say before I close, and we'll say talk about few innovations. One major thing happened when this research was even not conducted. There was because the NCDs, the major driver is the low birth rate baby and preterm and extreme preterm baby. So we actually put emphasis on the women, and they were provided 600 kilocalories of the additional nutrition, which included egg, jaggery and some dates, and they all sat together and ate it. And the system was set up for their care, and the delivery were effortless. There was no maternal mortality. IMR was almost negative, and the children, linear growth of children, were maintained. This is a technology revolution which is happening now and is being adopted by the government of India as a major technology revolution. So now the resurvey is happening, and one major intervention which is happening with the partnership with the Bangalore Yoga University, where there are trainers, they are providing yoga training and meditation training. This is one of the major lifestyle changes which is happening, and this has been a very successful ingredient. The community participation is very, very good. After seeing all these innovations, the other mandalas, which are neighboring mandalas, they actually approached Dr. Pratap Reddy that please teach us all, teach us this. So this revolution is now spreading around. So I will close my thing with saying that we are not only this, we are creating a lot of new diagnostics, liquid biopsy, diagnostic of cancer through liquid biopsy. A major trial has happened for the triple negative thing, with a triple magnetic. We are having algorithms in which those who are not responding to amputated alpha, etc. We are putting those things to work. We have created an Indian brain map. So huge amount of other technology revolutions are occurring. It is a report to talk about that. It will slowly appear on that. And with the chairman's blessing, we are going to a resurvey, and this transformation will perhaps create a new algorithm for the entire India. Thank you very much. And now I invite Dr. Surya Paul for the next presentation.
Respected sir, thank you very much for the talk. I would like to start with the first slide with the question that how can we use technology to address India's health. And for us, the major objectives were to look at the data, analyze it for meaningful use with trust, with integrity, and then develop and validate clinical AI ML models and accurately predict individualized and public health perspectives in a longitudinal fashion. And then finally, what is the most important thing is to integrate with clinicians' workflow and individual's patient journey, providing alerts and notification in that way. I start by talking about the study that we are doing for the past 3 years. We call it AI CVD, where it is a multi-center prospective use of a cardiovascular risk score that we developed with past 7 years data. And when we looked at a prospective cohort who were coming for health checks in our organization, we found out that this is the picture that you see for females and males with hypertension, with hypertension and without hypertension. Now, one of the significant things that you would notice here is that people under the age of 40 years who have hypertension have odds which are almost from 4 to 8 times higher than people who don't have hypertension. The other focus area for us is what is coming out through this research is that isolated diastolic hypertension, people who are having their diastolic BP higher than 90. Because what we are seeing is that every time their diastolic BP goes up by 10 millimeter, what we are looking at is that their risk is increasing by 2.38 times. Moving from hypertension to diabetes and uncontrolled diabetes, what we are seeing is that there is about 2.5 to 3.3 times higher risk of cardiovascular event in 7 years, with increased prevalence of additional comorbidities like hypertension